All right. Good morning, everyone. Thank you so much for joining us. My name is Yemi Akande-Bartsch, President and CEO of Focus St. Louis, and I'd like to welcome you to our Focus Forward series, conversations on critical leadership that we are learning at this unprecedented time. So joining us this morning is Dr. Sam Page, who is a physician and a politician, and he serves as the county exec for St. Louis County, a role that he's had since April 29th, 2019. You're coming up on an anniversary, Dr. Page. At one point, Dr. Page represented the 2nd District of St. Louis County Council from 2014 through 2019. I'd like to remind our attendees that if you do have questions, please go ahead and post them in our chat room so we can ask Dr. Page. Dr. Page, good morning, and thank you so much for joining us.
Thank you for having me.
Yes. Oh, absolutely. So how are you?
Well, it's a busy time. It's been a busy year, actually, cleaning up after a federal investigation and getting county government moving in the right direction, trying to restore trust was really what most of 2019 was about. And we were just getting ready to start tackling the region's most complicated problems: affordable housing, criminal justice reform, a lot of challenges in our community. And then we bumped into this worldwide pandemic, and we're navigating our way, and we're finding a path forward.
Wow. Certainly, I'm sure this was not what you had in mind when you got into politics, that pandemics would be one of the things that you would be managing. But what would you say are some of the initial leadership lessons that if you could just for a moment be reflective, that you're learning?
Well, I think you have to be prepared to make decisions without all of the information. And it's kind of like looking at a jigsaw puzzle with a third of the pieces missing, and you have to make a call. You have to call the picture and move forward. But indecisiveness in critical times is catastrophic. And that's one of the things that I did learn in my medical practice. I've been an anesthesiologist for 20 years. We have to take care of people in life-threatening situations, individuals in life-threatening situations, and make the call, make a decision, and move forward. And this is where we are in a pandemic, where we have to make some very difficult decisions. They are life-threatening, but they affect large groups of people instead of individuals. So I think being able to make a decision, I'm all about collaboration and cooperation and communication. But in an emergency, sometimes those are not optimal, and you have to make a decision and go.
So you talked about collaboration. I'd like to ask you a couple of questions on that. When this whole thing started to unfold, and at what point, where were you? What were you thinking? And who did you right away think, okay, I need to make sure that they are at the table as we make decisions for our region?
Well, I think this all started back in January. I mean, we were watching what was happening in Asia. We saw the stories about the new virus, what it meant, and how it compared to other challenges that they've had. And we hoped it would be managed, but we always recognize that these things are explosive, potentially explosive. So early on, we started talking about what we would do in St. Louis County. We started having those conversations in January. And by February, we started putting our plans together. And one of the first things I asked our health department was to recognize how this would impact our communities that had limited access to healthcare, because we talk about that all the time. And everything that I've done in my administration over the past year is to try and look at every complex problem, policy question through a lens of equity. And we applied that very early. We asked Dr. Jason Purnell to come and be a part of our team as a technical advisor, and make sure that we were looking at everything, as we always do, but also with some extra emphasis, because this is something we've never seen before.
Wow. Are you looking to other county execs nationwide?
I talked to Frank White a couple of days ago. He's county executive in Jackson County. I talked to him last week. I talked to Mayor Cruzen probably a couple of times a week. I talk to Steve Ellman in St. Charles County at least once or twice a week. Tim Brinker in Franklin County is presiding commissioner. Dennis Gannon in Jefferson County's the county executive. But we're in constant communication. Our public health departments talk every day. They're working cooperatively on contact tracing, which is really one of the most critical pieces of an epidemic strategy. Test, isolate, trace contacts, and do that across jurisdictional borders, because we know people don't stay in their neighborhood or their county.
That's true. So, recognizing that that's how you have been able to move forward and being very inclusive in terms of who has been at the table during this particular point in time, were there any gaps that you would say this pandemic brought forth, that if it wasn't for it, we would never know or begin to
Well, I
even
think
address
that
it?
everyone knows and understands, everyone that's involved in public health understands our healthcare disparities, underserved and underserved communities, and what we could be doing in those communities. But what this pandemic has done has shown how this virus can devastate in communities with limited access to healthcare, and also have the added difficulty of chronic medical problems.
Mm-hmm.
And so this virus has shown really a bright spotlight across our country and in our region on communities that have limited access to healthcare, and how we need to be paying more attention there. And that's something that I've understood for 20 years practicing medicine. It's something that our public health department has understood for years. That's why we have a facility in Berkeley. But it helps us make the argument to other people who may not have understood. And it helps me make the argument to dedicate more resources to where they're needed.
So we have a question from one of our attendees, and they want to thank you for your emphasis on equity. And what are some of the specific decisions? I know there's a press conference earlier on today that you have made with that in mind.
Well, then my first decision, even before we had the zip code maps and the testing results, was to bring Jason in to help us map this out. And then Andrea Jackson Jennings is my director of human services. So I brought her into emergency operations very early on to make sure that the humanitarian response was planned in parallel with the public health response. I've had constant discussions with our public health director about how we're going to put our resources into communities that need it the most. And I've talked to our prosecuting attorney, Wesley Bell, about our Justice Center and about how we can protect the inmates there, and conversations about inmates that would probably who have chronic medical problems, who would do poorly if they got sick, who were only there because they couldn't make bail or otherwise would be out, and try and find a safe way to put them in a better environment while we get through this epidemic.
So, with summer coming up, and, this is a time when traditionally violence spikes in the St. Louis region, can you talk about what types of adjustments need to be made to address violence in our communities within the context of COVID-19?
I think we have to have an enormous amount of respect for the stress that is involved with stay-at-home orders, for the difficulty some families have sheltering in place or staying at home, especially if there is a history of domestic violence. And we need to pay close attention to those concerns and make sure that everyone has a safe place to shelter when we're dealing with a stay-at-home order. We have to recognize that there's added stress, that this will bring out some mental health issues, and we have to make sure the services are there for mental health support.
That's true, because it's almost like an onion, and you peel back the layers and you find out that people are dealing with a lot during these times. What would you say has been your greatest challenge in coordinating what the regional response has been to the pandemic?
Well, I think the greatest challenge is managing communication and the sincere concern of everyone who wants to know everything, and everyone who in normal situations I would be very accessible to, but I can't always be accessible to everyone who has a question as quickly or as promptly as they would want to be heard So a lot of those responses are delegated to other staff members because in an emergency, things are different. And I'm pulled in a lot of different directions. I'm presented with very complex questions and decisions to make every day. And I have to choose a road to go down to keep our community moving in the right direction. I think communication with everyone that I would normally be very responsive to, and sometimes it takes me a day to get back to them, or sometimes I hear from a staff member. And so managing those expectations is a bit challenging.
So, we're in a moment of crisis, and, certainly it's a time that brings out, the best of people and certainly the worst of people, but I don't want to focus on the worst of people. I was just wondering, are there any particular individuals that you just want to acknowledge the great work, rolling up their sleeves, all hands on deck, that have just, helped move our region along with their efforts?
Well, I think I would recognize the co-directors of the St. Louis County Public Health Department, Emily Duchette, Dr. Emily Duchette, who's now off on maternity leave, and Spring Schmidt, who is acting director. I think they both have done phenomenal work in something that is unprecedented, and have worked very cooperatively with other public health officials in our region, and have all public health officials working in the same direction on similar plans. So I think that regionalism of the public health response is important. I've had very good communications with all the elected officials in our region, good relationships there. I think that's important. I'm really impressed with how our hospital systems have come together to coordinate policies, to coordinate resources, and to speak with one voice through Dr. Alex Garza and his updates every afternoon about the hospital capacity and the trajectory of this epidemic in our community. I think he's playing a very important role for us all.
Absolutely. So we have another question from one of our attendees. And as a physician, you are familiar with balancing values in a tough decision, such as allocation of scarce medical resources. Can you talk about the values you have had to balance in making some of these difficult decisions?
Well, I haven't been in a triage situation where, about individual patient care. We've made some hard decisions early on in social distancing that are very frustrating for our community, but they've paid dividends in keeping our epidemic manageable and allowing us to manage this for the most part within our existing hospital facilities, which is different than what happened in China, what happened in other parts of the community. You see them standing up hospitals in arenas. So, I think that was an important decision. But balancing resources, our greatest resource really is healthcare and the provision of that healthcare. And when the stimulus funds arrive, I intend to redirect that to the areas that need it the most. And some of those areas are historically underserved. And I'm hopeful that the council will quickly and emergently approve that funding so we can get it on the ground here in St. Louis and start taking care of people. The testing question is always complicated because we need more tests in our country and we need more tests in our community. And there are certainly areas in the community that see a lack of testing and believe sincerely in their heart that it is directed in one corner of the county or another. But really the lack of testing is countywide, and it's been applied with the same metric across the county. It's accessible to people who are really sick, first responders and healthcare workers, people who have chronic medical problems and who have symptoms have better access to testing. And then we see that pattern emerge that people with chronic medical problems who get sick are predominantly in North County. And that's why the zip code map shows more tests performed in North County and more sick people in North County.
Thank you for your response on that question. So everyone wants to know, is the stay-at-home order being extended? If so, what do we need to do to see it end?
Well, first of all, we have to recognize that the stay-at-home orders work and social distancing work, and nothing else works against a virus with no vaccine and no medical treatment that is devastating. Certain communities are massively devastated. and everyone is impacted, and people can get very sick from this, and there is a significant loss of life from this epidemic. The only thing that works is social distancing and limiting the spread of the virus in our community. Our hospital systems are very good at taking care of sick people if we don't help them, but they can't prevent people from getting sick. Only we can do that. And that's why these social distancing measures are so important. Looking at the trends, I just spoke to Dr. Garza. I was a few minutes late to you. I was talking to Dr. Garza a few minutes ago, and he'll have some news this afternoon to show us where we would have been and where we're headed, where we would have been without social distancing and where we're headed moving forward. But, you know, I don't see a pathway to ease social distancing before the middle of May, to ease it significantly. And I think to do so would be devastating to our community. It would not just risk, but almost guarantee a rebound. And that rebound will be much more difficult to manage if our hospital systems are exhausted, if they're having difficulty getting PPE and protective equipment, if the doctors and nurses are recovering from COVID-19 infections that they've contracted from taking care of these patients. Our first responders, you know, right now are some have been positive, some have been quarantined, some are returning to work. We have to make sure that our first responders are robust. But the rebound of this could be much worse than what we've seen so far if it's not managed appropriately. But we're having these conversations now with other elected leaders. We're having these conversations with our health systems. We're watching for guidance from the CDC. And we all have an enormous amount of respect for the devastation this has had on our economy, for the devastation it's had on people who've lost their jobs, and especially in the service type of work, especially in the hotel industry, especially around events that support, you know, large group events, restaurants. Some sectors of our economy at the national level, at the local level, have been devastated, and we don't take that lightly at all. It is a very serious problem. But we know that if we make the right decisions now, we can get through this with a smooth landing and continue a trajectory of recovery without interruption. If we make the wrong decision now, we can have a bounce that's worse. The economic impact will be longer than it would have been otherwise, and will be more devastating.
That's no truer words. And, you know, thank you for, you know, sharing with us, you know, your kind of metric for success and who's at the table helping you make these decisions. And part of that question has to do with the fact that, you know, we have Memorial Day coming up, and a lot of the county parks are closed. And I know we have parents who are listening, families who are hoping that perhaps that could just be their little staycation at the park. And so their questions are around perhaps, you know, are the county nature parks and trails going to remain closed? You know, or what can they do? What's the plan to release stress?
Well, I first want to recognize that all of our social distancing is devastating. And our parks are extraordinarily popular, especially in the spring. They were so popular that they were being overrun. And we looked at the Google Analytics, and the crowd data at the parks was impressive. And when the governor started closing some of the state parks, especially Castlewood, which is the most popular park in the state, then that pushed more people into county parks. Restrictions on crowds in other surrounding parks pushed more people onto county parks. And we were getting a lot of complaints about crowding, and we were seeing the crowding. Then we have park rangers who are diverted to help with first responders. And we just didn't have the ability to manage that, and it just wasn't safe. Our first concern is always going to be saving lives. And then certainly I'd like to get the trails open, and we're looking at a plan to do that. That's not going to happen this week or next, but we're looking at that plan and what that would look like. But we need to make sure that we can meter the parks appropriately, that we don't cause harm with our social distancing guidelines, and that we have park rangers who are available to help us manage that. We have 3 park rangers that are recovering from COVID-19 infection. And so we want to get them back. And we want to be able to bring our park rangers back from security functions and get them back in the parks. So it's a very complicated question. I recognize that the parks are extraordinarily popular. I hear from people every day about that. And all of it, in fact, I hear from people every day about the social distancing measures that we've had to take to save lives and it's
Mhm.
very frustrating. But these are very difficult decisions that we have to make. That it's part of being, it's part of having responsibility.
Yeah, absolutely. Thank you. How can community organizations help the region? What can nonprofits do to help this fight with COVID-19? We know there have been a number of agencies helping with food and financial assistance, but what more do you
Well, I
envision
would
people
expect, and
doing?
I would hope that nonprofits would stand ready to help scale up their services as our federal funds arrive in the community, because I would expect to have, and I hope to have, once the final rules and regulations are available, and they aren't written yet, but once they're available from the federal government, I hope to have some guidance on how we can continue our partnerships in the community with nonprofits that are providing some really important services in the community. And those services change based on
Mhm.
people who are staying at home now. They used to be able to provide those services in a different setting out in the community. So we'll have to adjust to that. But we're working with 40 different nonprofits and governments to provide a regional humanitarian response that's guided by our advisory team. And we're with Dr. Purnell and Dr. Will Ross to make sure that we're providing the services that are needed for people that are struggling, people that are out of work, people that are in food deserts. We're very sensitive to all of those issues, and we have a great network working cooperatively to address them across jurisdictions, city, county, surrounding counties, with many different nonprofits. But I would expect their footprint to increase over the next 6 months.
Okay, thank you. So here's another question. I believe that St. Louis is among a small minority of counties that operates public health facilities and clinics. Has this helped? And how are those county clinics faring during this crisis?
Well, St. Louis County has probably the biggest public health department in the state, probably in the Midwest, outside of Chicago. And we have that because there's a dedicated revenue stream, a dedicated property tax that goes towards public health. And it's been like that for decades. We do operate public health clinics, and we work cooperatively with other partners in the community to provide direct services and then to coordinate other services. In addition to direct services, we also have a very deep bench from a policy standpoint, and it's enabled us to navigate this epidemic pretty promptly. I asked them to try and stay about a week ahead in their planning. So when I thought we might need a stay-at-home order, I asked them to map that out 4 or 5 days in advance, so I could be looking at the details of that before we had to issue it. And when it came time to make the decision, the details were worked out, and we weren't trying to fumble through the details after it was time to make the decision. And we tried to stay ahead of that with everything we've done, and we would not have been able to do that if we didn't have such a vibrant and strong public health department. We contract with our surrounding communities to provide everything from medical examiner services to toxicology services, and we provide those services through other surrounding jurisdictions through memorandums of understanding and contracts. That's how we were able to build the prescription drug monitoring program in Missouri, by passing it in St. Louis County, creating a subscription program through our public health department, and now that program is available in 94% of the health providers in the state and covering 85% of the state population.
Wow.
That was all because of the strength of our county health department.
That's great. That's great. So we have another question here in terms of criminal justice reform. Do you think diversion will become more of a topic after we get through this pandemic? Since there's been a big concern with the number of inmates in our prison and jail systems.
Well, diversion from punishment and toward substance abuse treatment has been the mainstay of my administration. It's something that Wes LaBelle worked very, very diligently on since he became prosecuting attorney. We're working cooperatively with all those programs, and we've increased funding for those programs. I do believe that we have too many people in jail in our country, and that given the opportunity for healthcare and substance abuse treatment and a pathway to a job, they will not re-enter the criminal justice system, and we know that works. We see that with the federal program here in St. Louis, in the St. Louis region. There's a very active program towards job training, and the recidivism rate in the federal system in our community is under 10%. There's a lot of people working actively in this, even in the state system. There's some good programs in state government where folks are prepared for a job as they're finishing their sentence. Here in St. Louis County, we're trying to treat people before they enter the criminal justice system. We've always had drug courts, and prosecuting attorney Wesley Bell has ramped that up quite a bit. But we put more resources into diversion and substance abuse treatment, and we recognize the value of it.
Thank you. So given what we're now experiencing, have there been issues or projects that has stalled for you, that you were planning on moving this further, but right now you just had to hit the pause button?
Well, everything is stalled in county government because we're focused with a laser-like focus on responding to this worldwide pandemic, which has massively threatened lives in our community and has brought our economy to a screeching halt. But we are working on a lot of complicated issues, affordable housing, criminal justice reform actually is still moving along fine, and this epidemic has really probably amplified that a little bit. I was working on a process to streamline permitting in county government to make it easier to build and develop in our community. And that project has stalled a little bit. But there are a lot of things we're working on. Actually, we have a partnership with Washington University School of Social Work, and Molly Metzger works half-time in my office. And she brought 7 graduate students with her working on their master's in social work. And they all took a complex policy question that they were working on prior to us having to close down county government and work from home. We had a lot of projects going through Molly and that group.
That's great. What do you foresee in terms of short-term versus long-term economic development? If you had a crystal ball, what do you see?
Well, I think our economy will change a bit. After 9/11, it was never the same to fly on a plane again. And I think after this, we're all going to be much more comfortable with video conferencing and working from home. And we don't know how that changes business and the way we do business, but it will have a lasting impact. How we interact with each other, social distancing has changed. How we don't shake hands anymore. There's not as much hugging as there used to be. And it'll be a long time before those greetings are even the same. So there'll be a lot of changes. As far as the fundamentals of our economy, some sectors have been significantly crippled and will need some extra attention to come back. Some essential businesses have continued to move forward, but they have not thrived because volume is down and the economy is down. So there really aren't any winners in this setting. So it will take a lot of special attention to match small businesses with the federal programs that will help bring them back to life. I think most importantly is we give our business community and our economy an environment to be successful in. And that environment is one where we have a successful public health strategy to manage an epidemic. And that means lots of testing. And if I can say anything today, it's about testing, and more testing. Testing is how we treat the pandemic. It's how we keep people from getting too sick, and it's how we get our economy open. Because if we can test, isolate, and quarantine sick individuals and those they've had contact with, then we don't have to live with this 14th century strategy of epidemics, which is quarantine whole communities. And that's kind of this hybrid we're in. We're in this archaic sort of approach, which is quarantine large populations and limit activity, social distancing, and the 21st century approach to an epidemic, which is test, isolate, quarantine context. But we don't have enough tests in our country to do that. And that's why our economy is crippled right now. And that's why we have so many people that are sick.
So I'm going to jump ahead a little bit to the future because I've been in a number of meetings over the past week and a half that people are already looking ahead to recovery. What do you expect your leadership role to look like during recovery phase?
Well, I would like to see this plane, and I see recovery, I think we're on this flight right now, and I see this recovery as landing the plane smoothly and easing on social distancing, to a way that does not cause the epidemic to rebound in a way that we
Mhm.
can't manage effectively. So a smooth landing and a smooth transition and easing social distancing. It will not be a light switch. We will not go to stadiums full of people from where we are today in a few days or a week. There will be a transition. So managing that effectively, that means a robust testing strategy and a robust public health strategy. And we need two types of testing to be widely available. We need testing, serology testing, blood testing for immunity, so we can know who's immune. Because there will be many, many people in our community that had this and didn't know they had it or had mild symptoms. And they're not a risk, and they can be around people who may not be immune. And then the other piece is very, very wide testing for acute illness, the swabs, the PCR testing. And can we get that a quick turnaround? Can we get that test? Can we get it turned around in a couple of hours? Can we isolate the person who's infected, go back a week or so and find everyone they've come in contact with and quarantine those folks or check on those folks? And we have to have a massive contact tracing workforce. So one of the new jobs of the future in the next couple of years is contact tracing. Help us chase down people who've been exposed and give them instructions.
Wow. That's, yeah, I hadn't even thought about that. That's great. Any updates on a vaccine for this that you know of?
Well, we know that even here at St. Louis University, even our own institutions are working very, very furiously to develop a vaccine. Vaccines take years and years and years to develop. There is a lot of work around coronaviruses and vaccines. So we know that some of this work is already been moving along. And all of the estimates I've read or heard about are that it would take a year to have a vaccine available. And it would be a couple of years before it would be widely available. So the vaccines will go first to people who are more likely to do poorly, people with chronic medical problems, or people in the healthcare industry who would be exposed. So our healthcare workers and our first responders. So it will be similar to the testing. I would expect when the vaccines first come out, they will be available to the people who need them most, the people who are more likely to get really sick from COVID-19, and the people on the front lines.
So here's my final question to you. It's often a question I like to ask leaders, that if we were to look again, 5, 10, 15, 20 years from now, what are they hoping people would say about their leadership? Just looking back.
Well, I think the only thing you can ever ask of your leaders is to make the best decision with the information you have at the time you have to make the decision. You will always be faced with folks that will say, well, you should have done this or you should have done that. And almost entirely, those should have done recommendations come with information that wasn't available at the time the decision had to be made. So I think what I would hope that people would say about my mark would be that I made the best decisions with the information we had at the time, and that people were better off in the long run than they would have been otherwise.
One other question that just popped up. How do you ground yourself during all of this? What keeps you focused?
Well, I think you have to take some time for yourself. And I see that at Emergency Operations Center. They force people to take a day off because there really aren't any boundaries on the job of county executive. There's always something to do, always. So I think it's important to take some time for yourself. I spend some time with my family, get out in the yard and toss a football around with my 19-year-old who's in college from home right now. And spend some time with my family, watch a movie, play a board game. I talk to my wife a lot. She's a medical doctor, so she's on the front lines in her hospital taking care of patients. And I hear every day about the stories in the hospital and how they're managing this crisis.
Wow. Well, and on that note, I am seeing whether anyone is about to text me, because they all have my cell phone numbers, so they're also texting me. I want to thank you for the work that you're doing for our county. I want to thank you for, we're all learning best practices and collaboration. And, I think these are some models that will really carry our region forward. And I certainly hope that people are paying attention to, communication, social distancing. That is how we are going to help in the recovery to move our region forward. So thank you again for taking the time to spend with us today. And thank you everyone out there for joining us to talk to our county exec. And I'm reading some comments here. It said, thank you for taking care of all of us, Dr. Page. Stay well and stay safe. And we look forward to hearing from some of you at our next Focus Forward session. Have a great rest of the day, everyone.
Thank you. Thanks.
Thank you. Bye now.